Couch OT Stories. I am Wendy, and I'm here with the guest speaker, Mia. Thank you so much for joining us.
Thank you so much for having me. As Dr. Heine said, I'm Mia Garcia, and I did want to share what our podcast is going to be about today is pediatric conditions. This is something I'm passionate about and something I know Dr. Heine is very passionate about. And just to get us started today, I wanted to talk a little bit about our backgrounds, a little bit of our personal, professional. So I am 21 and I am in school for to be an occupational therapy assistant. And I really didn't know that I wanted to be this till about 2 years ago when I started preparing for this. So I lived in, I was born here in the U.S., but I lived in Cuernavaca, Mexico, and so I was about 6. And then I lived in various parts of Texas.
Okay.
I was raised a little bit by my mother, and then for the majority of my life, raised by my grandmother.
Okay.
As well as my siblings. I have 7 other siblings.
Wow, big family.
Big family. I am first generation college student. I'm the second of my siblings to graduate from high school.
That's great.
And so what really got me into OT was that I had been surrounded about it for about 11 years. My nephew has Down syndrome, and he came to live with us when he was 1.
Mm-hmm.
And so I got very involved very fast with him because it was kind of a whole custody thing. And I remember one night I just prayed to God that if he would let him live with us, that I would do everything I could to help my grandmother take care of him.
Wow.
And so since then, I've been very, as I've gotten older, increased my responsibilities with him, taking him to his therapies. And so I've always been around it, but it wasn't until I started working at a preschool with children with disabilities, and it's an inclusive school, but I got to see how the therapists, the OTs, the PTs, speech would take their kids out one by one, and then just all the progress we got to see inside the classroom, and then what the therapists were doing with them. It was just so rewarding, and I just thought, wow, like it's such a big difference they're making to the child, to the families. And so that's just a little bit about myself. So if Dr. Henry, you'd like to share.
Okay, sure. Yeah, and I want to commend you on that. I think most of us get into the field because we've had some type of personal experience, and I think that we really that gives us a special motivation and drive to make a difference in the lives of our patients and their family members, especially working in pediatrics.
Yes.
I have a pediatric, or I have a son who was born premature, and he was diagnosed about 1 year old with cerebral palsy. And kind of like with you, I started taking him to his appointments. And, I've seen physical therapy, speech therapy, occupational therapy. And, just looking at it all, it's kind of like, well, OT really looked like fun. Physical therapy, they were working and using big muscles and all this other stuff. And speech had to do with the mouth. Ooh, gross, don't like that. So I was like, okay, let me look into this OT. And that's kind of how it led me into where I am today. So, yeah, I'm very thankful and grateful that, believe it or not, that I did get a child who has special needs, which I know a lot of people are like, well, I'm so sorry that your child has special needs. And I'm like, why? I have a gift and
Yes,
you don't,
100%.
So I think that qualifies us in a completely different league, than a lot of other people who may not have that in their lives. So I think that's great.
Yes, 100%. I agree. It really is so life altering. And so that brings me to, I wanted to talk about how occupational therapy, I said, like we see OTs, especially with peds, it looks like you're just playing. It looks like
Yep.
it's so fun. Um, But I wanted to ask you how specifically occupational therapy relates or works with pediatrics. That it's not just playing games. It's
Yeah, so um, we are occupation based. And I know we did a podcast a little bit about what is OT, in that, there's a lot of misconceptions out there in the world. Everybody knows what is physical therapy. Um, and I'm going to turn it back on you. Did you know what occupational therapy was at the beginning? Or were you like, what is occupational therapy?
yeah. So no, I did not know what it was in the beginning. I just knew that this was something that he was going to because he needed it.
Mm-hmm.
So the only thing I think I really understood was feeding. Just
Okay.
because I knew that he had troubles with what we could give him.
Mm-hmm.
So he was working on that. But I
Mm-hmm.
really didn't know. So now I completely understand the value, the depth, and how critical really
Mm-hmm.
OT is for every children. Um, so bringing to our next kind of points, I wanted to kind of you've been working in pediatrics for
About 14 years
about
now.
14 years.
Mm-hmm.
So
Mm-hmm.
you've seen a various amount of things.
Yeah.
But most that I have seen is Down syndrome. Probably the most common I've seen a few children with autism.
Mm-hmm.
But I've also seen some very rare genetic or chromosomal conditions,
Okay.
including deletion of chromosome 13,
Mm-hmm.
chromosome 6, Coffin syndrome. Even one of the most rarest that I have seen is cerebral palsy with a genetic and with a
Component to it.
component to
Mm-hmm.
it with
Comorbidity.
comorbidity, yes, where the seventh, a tail end of a seventh chromosome was attached to the fifth chromosome, and
Wow.
it's completely like I've seen it how I've worked with this child. I've done my best to interact,
Mm-hmm.
but it's always it's new. There's very little research on it, so
Yeah.
everybody's doing their best.
So let me ask you, I'm going to interrupt you for just a second. How have you gotten such exposure? I have had some rare conditions, but probably not as many as that. So, how have you gotten to see that different? Is it where you're working? Is that where you've gotten to see that exposure to that stuff?
Yeah, so where I work, it's inclusive. So we have your, typical learners, and
Mm-hmm.
then it is people do get on a wait list for their children because it's such a intense and it is a highly accredited school because
Mm-hmm.
everybody is trained. Everybody has to have masters basically,
Okay.
or bachelor's degree in their child development or special education.
Okay.
Everybody's put through lots of trainings, and so
Mm-hmm.
people will interview the school, and then it's 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 kind of for the more rare conditions that we see.
Mm-hmm.
It's in the world. I mean, looking at the big picture, it's so rare, but looking in where we are right now, Dallas,
Mm-hmm.
it's actually could be your neighbor next door. It could be your
Yeah.
neighbor two streets down. It's
Yeah.
more common uh, than I realized,
Mm-hmm.
and so people search out for resources, and they found our school, and
That's
yeah,
great. That's
yeah,
great. Yeah, and I think that as a student, not only does the compassion you have for your family member, but then also because you have had experience with these rare conditions, medical conditions, I think that that really sets you up for being successful within this field because you've seen a wide variety of different medical conditions and stuff like that. And I think that there can be nothing but success. Um, is that what you want to do? Is do you want to go into pediatrics? I'm assuming.
yeah. Thank you for that. Yes, I do. I really am starting to lean toward the independence of it that we strive for, because I mentioned I caregive for my nephew who has Down syndrome, and I've seen him go from potty training to wearing underwear to showering himself and all these things as he's gotten older. But I see some areas where he does need more help, like with wiping and stuff like that. So I am really interested in relieving the caregivers, the family, by helping their loved one be as independent as possible. Because I mean, it's amazing for the family, but it's also amazing for the individual themselves. Yeah. It gives a sense of responsibility. I know for my nephew, he loves to have the feeling of I'm in charge, I can do this. Yeah. And it's rewarding for everybody.
Yeah, for sure, for sure.
So I did want to talk about some of how important early detection is, or genetic testing is before and after pregnancy. So with your son, you found out a year after, right? And that's something that I believe with cerebral palsy, it's not exactly, you can't test it.
You can't test it, and it's just one of those, luck of the draw, I guess is the right word. I had a typical pregnancy until the middle of my pregnancy when the doctor did an ultrasound, and my baby wasn't growing the way, he measured all of his limbs and his head, and he wasn't growing. And at that point, he started giving me hormone injections to help speed up the growth rate for my baby. And then he was born premature, 2 months premature, another month growth retarded. So, everything else was typical. I did have preeclampsia, which is high blood pressure. Other than that, everything else was completely normal. So there was no way, like all of the testing came back completely normal. Wow. So we had no idea to know that, and we knew that at the beginning, we didn't, for the first few days, we didn't know whether he would live or die. And then kind of once he got stable, then after that, then it was like, okay, let's look in to see what is going on and what kind of led us to where we were, him being born premature. So I think that for us, we're the oddity that, I think millions of people are affected by, because, cerebral palsy is simply brain damage, and that can happen at any time. Yeah. And so thankfully it's not a genetic condition. People can live completely normal lives, versus like your nephew who has Down syndrome, and some of the genetic conditions that you've seen are different. Yes. So maybe you can kind of talk a little bit about the conditions that you've seen, and I don't know if you've been able to talk with any of the family members about, their condition or anything like that.
Yeah, so a lot of I've noticed is I baby sit and I nanny children with special needs, and a lot of what I do see, I'm like, parents like to talk to me about kind of the things, just they just like to pick my brain or whatever I know, because a lot of families are just so desperate because it's new,
they're scared.
They're scared, yeah, it's new, it's a roller coaster. Yeah. It's an awesome one, but it's not an easy one. So a lot of things that we do see, struggles with because it affects not just their IQ, but how their mind processes things, but also physically. So especially with their speech muscles, those oromotor skills, there's a lot of delays in processing, or even just motor coordination. It might take a child with Down syndrome till they're 15 to actually accurately do hopscotch, or to ride a bike, or to figure how to use both hands to pull their pants down versus just one. And I see a lot of left side neglect or right side neglect, meaning they tend to not use one side of their body. Yeah. So yeah, and I see a lot of behavior. Yeah. A lot of behavior. And I would say that some of this could be very just because of their IQ level. And also, I have seen family does play an effect into
I was just about to say,
Yes.
these families are born with these children. Um, Kids are smart.
Yes.
They can figure things out, even if they have disabilities. And I think that um, the kids are very able, even with a lower IQ, to manipulate parents. And parents feel a lot of the times, I know my husband felt a big sense of guilt of maybe I did this to my son, when in theory, for us, it wasn't anything that we did, versus maybe some of your parents that they have a genetic condition, maybe they didn't know about it. I can see how guilt can play a lot into that.
Right.
And as a parent, goodness gracious, I have two children. It plays there's so much guilt involved in it all the way. So I definitely can see how guilt can affect and maybe allow that type of behavior.
Yeah, I totally understand. I'm guilty of it myself because I tend to just, oh, I feel bad. Oh, baby, like my poor baby, he can't do this, so I should just let him.
Yeah.
So it's so easy. I would
It
say
is.
it's so easy to get into
Easy.
that.
And it's cute when how old is he now?
11.
So it's cute when he's 11, and when he's 18, it's really not so cute.
Right. That's something that we are really, really seeing now, because some of the stuff that he did when he was 5, he's doing now that it's just not appropriate.
Yeah.
So yeah, that's something that we will get into more too as we go on.
Okay.
So some of and we spoke about this, somehow their daily activities or their overall development can be affected. So I did want to ask you about one of the big things that we see, especially with kids at my job, leaving, because it's from 6 months old to 6 years old. Transitioning over to
the public school system.
Yeah, to public school or even private school. There's a school in Dallas that has special schools, a special school for children, but which everybody shoots to go to the school, but this school only allows a certain amount of people, and then they want very high functioning, and not all their children are going to be high functioning.
Yeah.
Right, so a lot of them will go to public schools, and it's a hard transition.
Yeah.
So I did want to ask you how some of the things that you have noticed that in school age, elementary, middle, or high school, things that you see are affected.
Yeah, so I think that a lot of that is dependent upon where you go. If you go to a private school, number one, that's money out of your pocket that you have to pay.
Right.
Because they are a private school, they do not have to accept accommodations.
Right.
So if you don't take money from the state, you do not have to accommodate and make exceptions. So maybe you have an individual who needs an individual testing room where he just takes the test by themselves, extra time, whatever. They don't have to do any of that. And so thankfully, we were able to grow up in Argyle, my kids were, and they have a very great resource, the co-op that was in place when my kids were there. And so the transition for most of the people that I've seen in Argyle has been amazing. Now, I have worked with children in other districts like Arlington and HEB and stuff like that. And I think that it's been very hard for them because, number one, a lot of my parents are Spanish speaking. They do not understand. There's a lost in translation. Even if there is a translator there in the ARD meetings, stuff gets lost. They don't know. They're not educated about, you can't ask for XYZ. And so I think that there's this big disconnect with a group of population that really need those type of services. And I don't quite know exactly how we could go about educating um, you know these individuals about, and I do this, I try to do as best a job as I can, but I do think that there are kids who get dropped through the cracks.
Right.
And
Yeah.
they go to public school, and then they may not be a very, oh, what's the right word? They may not be a child that is very severely impaired. Maybe they're moderate intellectual
Right. Yeah.
disabilities. And then they're lumped into this category where you have, individuals that are very mild in impairment, all the way to the ones who, are hitting themselves and throwing themselves against the wall.
Yes.
And so I do feel like that is a big part of this process that is missing. So I applaud you for sure for bringing that up.
Yeah, so I think that is such an important topic, and like you shared, your kids had a really great opportunity. Your son did. So for our situation, we are on that opposite side of the spectrum in the city that we live in. Our schools had he had to be moved to three different schools. He's now at his fourth school.
Wow.
So every school would say, "Oh, we're closing our program, or we don't have space for him anymore. Oh, we just can't."
That's
And
horrible.
it would be really, just really terrible. And like you said, it falls through the cracks.
Yeah.
He just got pushed through the waves, and he is very high functioning. And so we would see his classmates would be in wheelchairs, like a nonverbal.
Yeah.
Can't really move, can't really do anything, but he's in the same classroom, like you just said. That it's such a variety all thrown into one classroom, where the teachers are underpaid and
there's not enough aides,
not enough help, and there's also a lack of education, especially everything that's happened after COVID.
Yeah.
Like, it has been such a drastic change for us, because pre-COVID we had a really great teacher, and he was amazing, and he was so determined to help my baby out, and he would tell us every day, "Jaden did this today, Jaden did that today."
Yeah.
Um, uh, so now that he's in middle school, we've gotten him into a school that we had to apply for. It's still public, but it's charter, and he has a much smaller classroom.
That's
kids
good.
are all around the same level. They're all
okay. That's great.
Right. It's been really, really. It's been such a drastic change for us, and a good change.
Yeah.
Where the kids are, because it's such a small class, and they have a two personnel in the class, that they're able to give him that one-on-one attention that
That's great. That's great.
And we've gotten calls from like the therapist saying, "Hey, we're here to help your son," and we've never had anybody from the school
do that
and say that what they want to do, what they want to work on. And so it's been a great transition.
Is he going to be able to go to high school there too, or will he have to switch?
We're really hoping to. So it's a brand new school.
Okay.
Last year they went to 6th grade. This year they're going to 7th grade. So we're hoping that they'll add more years, because it is a K through 12.
Okay.
But because it's newer, they're still kind of
tapering up.
Yeah, tapering up. So yeah, this is a really important topic. I've seen, and like you mentioned, that how to give that to parents who are uneducated.
Yeah.
So I myself really wasn't until I got older, especially after I graduated high school, that I've seen so much of the downside of public schools. So I started doing my research, and I know for Dallas, there's Down Syndrome Guild of Dallas.
Oh, okay.
And they host a lot of IEP educational seminars, art meetings. They do resources for public schools for parents.
Okay.
And then they also have a Spanish.
I was going to ask that. Okay.
So they have a Spanish coordinator who is in charge of reaching out to families who are Spanish speaking, who need these resources. So something I really love is that is Down Syndrome Guild. They do a lot of child advocates, special education advocates for people who have kids in the system, and then as well for their transitions. Okay. So yeah, that's a really important topic. I'm really glad that we got to talk about that.
Yeah, for sure.
I did want to also talk to you, which something that we both have experienced is how the family is affected. How and I'm how the lineup of caretakers. So after, especially with you have a child with a disability, if something happens to you, you have to have a backup.
Correct.
Appointments parent has to take off work all the time because the child has 5 appointments a month, sometimes 3 appointments a week. So I wanted to talk to you about that experience and how you've seen the family dynamic has shifted.
And I think that, for myself, I was very blessed and fortunate in that when my son was born, because of his pre-existing medical conditions, it could have killed him to go to a daycare.
Right.
So we made the sacrifice and adjusted finances so that I was able to stay home. Because as you just said, there was one day where we had 4 and 5 appointments when he was up until probably 15, 20 months. Like every week, he would have the developmental psychologist, the neonatologist, the perinatal, all of these different doctors that we would have to go to, the retina specialist, especially being a premature baby. And so we were very fortunate in that we didn't have to stress as much over that. I mean, we still had financial concerns, but I was able to give my baby the attention that he needed.
That's awesome.
However, I guess good and a negative. I've seen it both ways in practicing. I've seen individuals that I really don't understand because it's not my job to understand their dynamic. But nobody in the house is working. They're all taking advantage, or I don't know what the right word is, but living off the system. I had a patient whose mom was Spanish speaking. She never worked. She had 4 kids. 3 of them all of them had different dads. 3 of them had very severe medical conditions.
Wow.
And like one was on a trach, one had Down syndrome, encephalopathy. The other daughter had a rare medical condition, a chromosomal, I don't remember what it was, and then she was pregnant again with another baby, and it's okay, so and she doesn't raise her kids.
Yeah.
She has services from the state come in and take care of her babies, and the only time she ever would take care of them would be on the weekends, and that was it. So 5 or 7 days she had somebody, and I never met the mom at all. I met the nurses, but I've never met the mom. So, I think that every family is different. Every dynamic is different. And as an OT, you're walking in and you don't quite, my job is to ask what is pertinent and relevant to the child.
Yes.
Other than that, I'm not there to be nosy and to ask, well, you know how you get pregnant, so why don't you stop when you have 3 of the 4 that are disabled? Why don't you not have kids? And none of the dads were involved in the lives at all. Didn't pay any child support, nothing.
Wow.
So I think that, and then I've seen families that are single parent, have a child, they're working as hard as they can. They didn't graduate from high school. They're working at McDonald's, trying the best, and they can't make ends meet. So I think that it's a real struggle. And one thing that I really teach my students in the program,
Mm-hmm.
um, get resources so that whenever you're practicing, you've got resources and you can say, here you go, here's the Dallas Guild that you were talking about. Okay, what about this? What about this? What about this? And then that way you've got resources that you can give out to your families, because that's what we're all about in OT is advocacy,
Yes,
right?
yeah.
How do we advocate for our patients and our families?
Yes, that's great. I've seen some interesting stories myself, and I know for our case, it has been such a struggle with my grandmother was single parent for so long, and so it was really, really hard, but she tried her best. She did her best.
Mm-hmm.
She uh, got married, and it's also even for somebody who's joining the family and entering this world. I feel for my pops because it's you're kind of being thrown into this brand new world,
Yeah.
and of course it's by choice, but also it's not
It's
easy.
still hard to adjust
Right,
when you're not used to it.
right.
Yeah.
It's a big
Mm-hmm.
adjustment, and then also having to provide with.
Yeah.
My grandmother, she had to take off so much time off work to meet those appointments and
Yeah.
to get him all the services because it was a custody battle. It was part of he's has to go to the Reese Jones Center because of how he came to live with us,
Mm-hmm.
and so everything is always closely monitored. And so my grandmother, like, she's so keen about never missing appointments, always making sure that everything is up to date, immunizations,
Because
all those things.
you have one little chance,
Yeah.
and and I don't even get me started about the system, because I think that you miss that one little
Mm-hmm.
bitty thing, and you're fearful that your
That
child
creates a
can be taken.
fear.
Yeah.
Right, it creates such a fear.
Yeah.
And another thing I did want to talk about is how when you have a child with disability, and let's say I mean, in a traditional age, you would be maybe at least 25 years older than your child.
Yeah.
And so you are older, and of course, their life expands can vary.
Mm-hmm.
Um, but your lifespan as well anything can happen at any moment.
Absolutely.
And so
Absolutely.
I've been to resources. I try to go to resource events, and one of the things I always see is lawyers and advocates about who is going to take care of your child next. Who is your plan B? Who is your plan C? Because do you want, and for like class or Texas HML, like they will ask uh, where you want your child to go for transition when they get older. Do you want them to go to a resident home, to live in basically a nursing home?
Yeah. Yeah.
And I mean, I would never want him to, but that's the scary thing. You have to have a plan.
Yeah.
And that's something as OTs that we can advocate for, or we can educate our parents about. Is that what is your plan? Because it's not easy to think about, but you have to. It's kind of like a will. You have to draw up a will because anything can happen any day.
Yeah, and as an OT coming in, that's one thing, I really don't address that when they're 9, 10, 11. Mm-hmm. But once they're about 11, 12, and older, I do start to talk to families about what's gonna happen when you pass away. Who's gonna take care of your child? And some of the times parents are left speechless.
Yes.
Because I think it's something like 50% or higher people die without a will. And that's really an easy thing. You can literally go on the computer, type, get it notarized, and you're done. But I think part of our fear of dying, if that's even a right word, or morality, that's not the right word, but anyway, we don't want to think about us dying. And so if we don't think about it, then it's not going to happen. So I
Mm-hmm.
do think that that's an important topic that you do address and talk about with family members. So,
Yes. That actually kind of transitions us into one of my next points was what kind of goals do we OT set that in the long run will benefit the child, the parent, and transition as they get into adulthood.
mm-hmm,
And so some of those things like planning for the future.
mm-hmm,
Another thing I want to talk about was independence.
mm-hmm,
So how would you say that? I know for us, we try our best to have him do as much as he can.
yeah, yeah.
Sometimes I'll be honest, we step in when we should let him.
Mm-hmm.
And
Enabling, yeah,
yeah,
uh-huh, yeah,
enabling.
yeah.
So how have you seen that effect of maybe enabling or actually or not assisting, and the child kind of suffers from not being taught how to do it, and so they learn helplessness or all those kinds of things. So how would you, with with your experience in the long run, OT, the things that we should be working for them to have a easier or smoother transition?
I think that's a really great point to ask, and I think it's really dependent upon the family.
Mm-hmm.
I myself, we have not treated our son any differently than his sister, who has zero disabilities. Whenever he struggles to do something, suck it up, Buttercup. You're doing it, right?
Yes, yeah.
And I think that has made him a stronger individual.
Awesome.
I have seen families where they do not step in that a child didn't have any toys when I went
Mm.
to evaluate him. He wasn't even really allowed to sit at the dinner table,
Mm, wow.
and he was significantly delayed versus his peers. And you talked about the learned helplessness, the inability to adjust. And, I worry about where that child is now.
Yeah.
Most likely, he's probably been taken away from
Yeah.
with CPS getting involved and stuff like that. And I think that it's the mentality, and I think a lot of it has to do with culture,
Yeah.
because the Hispanic culture is generally, and the Asian culture is, you take care of your family members.
Yeah.
And so I had an individual who had a kiddo who had Down syndrome, and you know dad would dad spoke English,
Mm-hmm.
and it was like, oh, we really want him to feed himself. And then when we would leave, mom would secretly feed him the whole
Mm.
time. And he would throw and have these massive fits, and dad wasn't understanding that mom was enabling him and
Yeah.
doing all of this
Mm-hmm.
stuff. So I think as an OT, you have to read your family.
Yeah.
You have to be respectful of what their culture is.
Mm-hmm.
And it's a very fine line that you have to do. You have to present it in a way. Some of the times it comes across a little bit on the harsh side, but you have to get your point across that this may not be what's best for the individual.
Yes.
So,
Yeah, I've seen that as well. I've seen and a lot of that too with behavior. I think we kind of spoke on that earlier,
mm-hmm.
where your family really does have to be all in accordance.
Yeah.
And ideally, of course, we want everybody to be on the same page so
Yeah.
that everybody is looking for the benefit of the child with a disability.
Mm-hmm.
Although that's not always the case.
Correct. Correct.
Um, so we kind of spoke on this earlier as well that all the things are affected with children with disabilities or any pediatric condition. It could be things like their fine motor skills, their gross motor skills, their sensory processing, cognitive behavior, social skills, adaptive skills, and really practical skills too. I did want to throw that out there. Things that are so easy for us who don't have any conditions. It's such a challenge and something that has to be that where we come in as
Yeah.
OTs to really help. And so I did want to ask you if you could share a real life example of how you maybe benefited a child, or how your work with a child, like maybe you started from not being able to do something to doing something, and it just created such great change in the child and the family. If you have like that rewarding experience.
Yeah, there's one story that means the world to me. I started working with an individual probably when he was 6 months old, and he was not sitting up. Um, um, he was actually not sitting at all, even with support. He was completely floppy. He had a congenital heart condition and ended up having to have heart surgery. Maybe it was later than 6 months. Developmentally, he was at 6 months. Maybe he was a year when I saw him. So I got him to where he was able to sit up.
Wow.
He was able to crawl.
Oh.
He was able to start walking behind a toy
Oh, wow.
and
That's
doing a
amazing.
push toy. I was the only one seeing him. Physical therapy was not seeing him.
Wow.
And so I worked on a lot of that. And unfortunately, insurance
Oh,
cut
yeah.
me off. Yeah, that's a whole separate topic in
Yeah.
itself. But unfortunately, the child got an infection and he passed away. Um, and it still does hurt me to this day. But knowing, I still see the mom. We go to church together, and whenever she sees me, she just immediately comes over and just gives me a hug because I just remind her of her son and what I was able to do for that family. And that was my when I started becoming an OT, that's what I wanted to do. I wanted to make the difference in the life of one individual. Um, and then I have another individual that I started seeing in elementary school, and he recently graduated from high school, and I'm like, oh my gosh, and now he's going to TCU, and yeah, it's when you're working with children, it is so rewarding in that you make such a huge difference in their lives because you can see them for years. And you do become attached and bonded, and that's what you have to look forward to. It's very meaningful, and something that I do, something you may want to do, is I keep a scrapbook of different, unfortunately I work with older adults too, and when those individuals pass away, like even before they pass away, some of the patients, when I used to work in a skilled facility, we would take a picture together when they would leave, and then I put this in my scrapbook, and then I write memories of them, like nicknames or something special about them. And so I can go to my scrapbook at any time, and I can remember all of the people that I've at least at one point in time made a difference in their lives.
Oh,
So
that is so precious, and that's what I love about OT, is that we have that approach, and
absolutely,
it's just beautiful.
mm-hmm.
And so on the other side of this is that sometimes there is a wall, and we can be unsuccessful.
Yes.
And so I did want to ask you, following that, what has been that unsuccessful case, and how did that make you feel?
Really frustrated. And a lot of the times not, it's more the parent, it's more the enabler than the child per se, because the child can only do so much, and it's up to the parent to reinforce. And if the parent isn't reinforcing, I just feel so frustrated because they're not helping. They're saying they want to help their child, but at the end of the day, they're not helping their
Yeah.
child. And so I feel very frustrated when I'm trying to help this child make a difference and I'm not successful.
Yeah, see, um, so something that I did experience at my job, I've seen, like I said, I've seen great progress made in so many children. We did have a case where one of the children had Rets, and so this was something that was not going to get better, and something that was just, it was degenerative. It was just decreasing. It was plateau.
Yeah.
And so that's something that we may see with OT. I believe she had all the services.
Yeah.
But I think at a certain point it has to stop.
It has to stop.
It's not.
You're not making progress.
You're not making progress, and then like you said, insurance is a whole other thing. So that was one of that I seen that it's heartbreaking, and it's kind of one of those things that you just.
It's only so much you can do.
There's only so much you can do, and it is what it is.
Yeah.
So would you say, how does missing out on therapy affect the child eventually, and where they may end up in elderhood? So we kind of spoke about that a little bit, but I just wanted to say how some of the skills that they might miss out on. Say a parent wasn't able to get their child home services, and they're kind of just living with this child, but not really. They didn't get the PT, they didn't get the OT or the speech, and so how would you say when they get into their elderhood, the opposite side of the spectrum of their life, like how would that be affected?
Well, and I think individuals who are like that, these are the ones that are typically at the group homes or at the skilled facilities. They're unable to take care of themselves if they even get to that point. We do have individuals or have known individuals who are somewhat successful-ish, but they're able to make a living for themselves, but they get involved in a lot of the times drinking. And they learn maladaptive strategies to dealing with stressors and things that happen in their lives, and they become disabled by the government and can't afford their houses. And so I think that there's a lot of that that is out there with regards to older adults. But I think that a bigger part of it is there's a big mental component to it, that it's, I don't want to say it's up and coming, but we've been talking about all of this mental health, and it's kind of come to the forefront of how important mental health is. And I think they've missed out on a lot of skills, but I think that at the end of the day there's a lot of underlying mental health issues that are at play in these individuals' lives, and I think that's what's sad to me, is because they have undiagnosed medical conditions.
Well, you bring up a really good point. I would say that I have seen, especially with trying to get involved with resources, I do love that there is a lot more coming out with mental health, and there's a lot more coming out with college programs for people with disabilities or mental health conditions, and there's work opportunities, and that, I mean, maybe not as much as we would like there to be, but
I am gonna say, my son, again, is special needs, and I'm learning a lot about the what's the word, the prejudice that's out there. But he, as a young adult of 26, he is out there trying very hard. He has 2 degrees. He's an Eagle Scout. You'd think he could go get a job anywhere. And he's just not been successful. And so thankfully we've been in touch with various different disability support services.
Yes.
And so there's the Texas Workforce Commission.
Yes. Yeah.
That specifically helps, and so this may be good for your nephew. That helps individuals who have disabilities. Specifically, they work at the government, and there are companies that come to Texas Workforce and say, okay, I need these jobs filled, and we're willing to give it to somebody who's classified as disabled. Now, granted, nothing's happened yet, but we just got a message today that they are having another job fair coming up.
Oh, that's amazing.
And it's a Denton hiring event, Workforce Solutions for North Central Texas. So it's a job fair specifically for individuals who have disabilities.
Oh, that's awesome. I hope that'll be a blessing.
I hope so too.
And that's another thing that we can just touch very lightly on, is that there is, like, I know Kroger,
he worked at Kroger, and they're I would never wish Kroger on anybody.
Right.
They're mentally abusive.
I've heard good things from certain people, and then also I've heard bad things, which is like, it's such a hit or miss. And then also with the pay, because I've just recently learned that it's below minimum wage for somebody with Down syndrome, most likely. And it's
sad.
It's so sad. It's something that needs to be worked on. So I'm glad that we were able today to talk about a lot of things about the family. We touched a little bit on the culture, a little bit about the things that you see, struggles in school, struggles that you see at home, struggles we see with the family, but also the positive side, how OT can be so powerful, so rewarding, and so critical to helping your child with a disability or these pediatric conditions. And I'm really glad that we have that approach. Like I mentioned earlier, we have a holistic approach. And I did research I found a lot of websites online because one of my points I did want to talk about today was, what are things that families could do at home that are easy. And so I found a bunch of websites that give really simple things, inexpensive things, or even using things you have at home to help your child, to create a motivated environment for them to learn.
So I'm glad that you mentioned that, because I'm gonna share this with you. When I went back to school to get my doctorate, my doctoral capstone was exactly what you just talked about. And what I did is I created a virtual bookshelf.
Wow.
And what this was is videos of me teaching families how to use items around their house for gross motor, visual motor, whatever you wanted to do. And then I attached it to a QR code. Even the poorest of families have a smartphone. And so all they had to do is click this QR code, scan it, and then it took them to these different things.
Yes,
so that can be something that you can do, and you can teach your families. Okay, here you go. Here's a video on sensory activities. Here's a video on this. Here's a video on resources. So that can be something that you can do in your future practice, and then just have that, again, another tool belt that we have on our toolkit.
Yeah, that's a really great idea. Yeah, my whole idea behind this was accessible, easy, incorporate some of these things you don't even have to think about.
Yeah.
And and that's our whole thing. We want any way we can to help them. That's what we do.
Yeah.
So So thank you so much for today, and
you're welcome.
Definitely probably needs a part 2, but this is a great topic, and I'm really glad that we got to talk about a lot of the things that we see.
Absolutely. Thank you so much for bringing this great information